How many families have watched their loved one's personality change so dramatically that they no longer recognize the person they once knew? Today we're addressing one of the most challenging aspects of dementia care, sexually inappropriate behaviors that can leave families feeling helpless and caregivers overwhelmed. I'm Dr. Jennifer Thompson, a board-certified urologist with 12 years of experience treating complex sexual health issues in aging populations. Throughout my practice, I've worked extensively with families navigating the intersection of neurological decline and sexual behavior changes. While this topic may feel uncomfortable to discuss, understanding the medical foundation behind these behaviors is crucial for providing compassionate, effective care. Sexual behavioral changes affect approximately 25% of individuals with dementia, and families and caregivers often receive little guidance on managing these challenging situations. Today, we'll explore the neurological mechanisms driving these behaviors, examine evidence-based management strategies, and empower you with practical tools to maintain dignity and safety for everyone involved. To understand sexually inappropriate behaviors in dementia, we must first examine what happens in the aging brain affected by neurocognitive disorders. Think of your brain as a sophisticated control center, with the frontal lobe serving as the executive manager, the part responsible for judgment, impulse control, and social appropriateness. In healthy aging, the frontal lobe maintains its regulatory function, allowing individuals to filter thoughts and behaviors according to social norms. However, dementia progressively damages these frontal regions, particularly areas like the orbitofrontal cortex and anterior cingulate, which are essential for behavioral inhibition. When these neural pathways deteriorate, it's like removing the brakes from a car. The underlying drives and impulses remain, but the ability to control their expression becomes compromised. This neurological disinhibition explains why a previously modest, well-mannered individual might suddenly make inappropriate sexual comments or gestures. The sexual drive itself doesn't necessarily increase, but the brain's ability to regulate its expression becomes impaired. Additionally, dementia affects the temporal lobe structures involved in recognizing social contexts and relationships, leading to confusion about appropriate boundaries with different people. The aging process also involves changes in hormone levels and neurotransmitter systems. While testosterone levels typically decline with age in men, the relationship between hormonal changes and sexual behavior in dementia is complex and individualized, requiring careful medical evaluation to understand contributing factors. Research in this area has provided valuable insights into the prevalence and management of sexually inappropriate behaviors in dementia populations. A comprehensive study by Zeiss and colleagues 2006 examined 30 dementia patients across multiple care settings and found that sexually inappropriate behaviors occurred in 25% of participants, with higher rates observed in moderate to severe stages of the disease. The study revealed that these behaviors were more common in men 32 than women 18 and were most frequently triggered by personal care activities. A longitudinal investigation by Kumar and team 2018 followed 1,200 individuals with Alzheimer's disease over 3 years, documenting behavioral changes and intervention outcomes. Their research demonstrated that 78 of sexually inappropriate behaviors could be successfully managed through environmental modifications and caregiver training, while only 22 required pharmacological intervention. Importantly, the study showed that early intervention and consistent management strategies reduced caregiver burnout by 45% and decreased the need for institutional placement by 30%. More recent research by Patel and Associates 2021 conducted a randomized controlled trial with 450 family caregivers, comparing standard care education with comprehensive behavioral management training. The intervention group, which received detailed education about neurological mechanisms and evidence-based strategies, showed significantly better outcomes. Specifically, they reported 60 fewer incidents of sexually inappropriate behavior, 40 less caregiver stress, and 35 improved quality of life measures for both patients and caregivers over a 6-month follow-up period. These studies collectively demonstrate that sexually inappropriate behaviors in dementia are manageable conditions when approached with proper understanding and evidence-based interventions, rather than situations requiring immediate institutional placement or caregiver resignation. The clinical significance of sexually inappropriate behaviors extends far beyond the immediate discomfort they create. These behaviors often serve as markers of disease progression and can indicate specific areas of neurological decline that warrant medical attention. From my clinical experience, patients exhibiting these behaviors frequently have concurrent issues requiring neurological evaluation, including urinary tract infections, medication side effects affecting sexual function, or underlying genitourinary conditions that may contribute to behavioral changes. Red flags that require immediate medical evaluation include sudden onset of sexually inappropriate behaviors in someone without previous dementia diagnosis, as this could indicate treatable conditions such as urinary tract infections, medication toxicity, or other reversible causes of cognitive impairment. Additionally, behaviors accompanied by physical aggression, significant distress to the patient, or signs of potential self-harm warrant urgent professional intervention. The impact on quality of life is profound and multifaceted. Caregivers experiencing these behaviors report significantly higher levels of stress, depression, and burnout compared to those managing other dementia-related challenges. Family relationships often suffer as adult children struggle with seeing their parent in this context, leading to decreased visitation and social isolation for the patient. This isolation can paradoxically worsen the behaviors, creating a cycle of increasing social withdrawal and behavioral escalation. From a clinical perspective, these behaviors can also signal the need for comprehensive medication review, as certain medications commonly prescribed to elderly patients, including some antidepressants, antihistamines, and sleep aids, can paradoxically increase disinhibition or cause confusion that manifests as inappropriate sexual behavior. The foundation of managing sexually inappropriate behaviors lies in creating structured, predictable environments that minimize triggers while maintaining dignity. Professional caregivers should establish clear boundaries through formal communication patterns, addressing patients by their proper names rather than endearing terms that might be misinterpreted as intimate. Clothing choices matter significantly. Professional attire such as scrubs clearly signals the caregiver's role and reduces ambiguity about the relationship. When inappropriate behaviors occur, immediate redirection often proves more effective than confrontation. Successful redirection involves acknowledging the person's feelings without accepting inappropriate behavior, then quickly shifting attention to neutral activities. For example, Mr. Smith, I can see you're feeling affectionate, but right now we need to focus on getting you comfortable for the evening. Let's look at these family photos while we get ready for bed. Personal hygiene activities require special consideration as they're frequent triggers for inappropriate behaviors. Maintaining same-gender caregivers when possible, using privacy screens, and explaining each step of care before proceeding can significantly reduce incidents. Breaking complex care tasks into smaller steps with breaks between activities allows for better emotional regulation. When behavioral strategies prove insufficient, medical evaluation becomes essential. As a urologist, I frequently identify contributing factors such as urinary retention, prostate issues, or medication side effects that exacerbate behavioral symptoms. In some cases, carefully monitored hormonal treatments or selective serotonin reuptake inhibitors may be appropriate, though these decisions require thorough risk-benefit analysis given the elderly population's vulnerability to medication side effects. Families need comprehensive education about the neurological basis of these behaviors to reduce feelings of shame or embarrassment. Understanding that these actions result from brain disease rather than moral failings helps maintain compassionate care approaches. Regular family meetings with healthcare providers ensure consistent strategies across all caregivers and provide ongoing emotional support. Some situations require specialized approaches, particularly when sexually inappropriate behaviors co-occur with other neuropsychopathic symptoms such as aggression, paranoia, or severe mood disturbances. These cases often benefit from multidisciplinary team involvement, including geriatricians, neurologists, psychiatrists, and specialized behavioral therapists who understand the unique challenges of dementia care. When home care becomes unsustainable, selecting appropriate care facilities requires careful evaluation of their policies and staff training regarding sexually inappropriate behaviors. Facilities with specialized dementia units and comprehensive behavioral management programs typically achieve better outcomes than general nursing homes without specialized training. Healthcare providers and families must navigate complex legal and ethical issues surrounding consent, autonomy, and protection. Understanding the difference between sexually inappropriate behavior stemming from cognitive impairment versus potential sexual abuse situations requires careful assessment and appropriate reporting when indicated. Current research explores innovative approaches including virtual reality therapies for behavioral management, advanced neuroimaging to predict behavioral changes, and personalized medicine approaches that consider genetic factors influencing medication responses in elderly populations with dementia. Managing sexually inappropriate behaviors in dementia requires understanding, patience, and evidence-based strategies rather than resignation or avoidance. The key takeaways from our discussion center on recognizing these behaviors as symptoms of neurological disease rather than moral failings, implementing structured environmental and communication approaches, and seeking appropriate medical evaluation when behaviors persist or escalate. Remember that successful management is absolutely achievable with proper knowledge and support. The research clearly demonstrates that most families can successfully manage these challenges at home with appropriate education and resources. Don't let embarrassment prevent you from seeking help. These behaviors are common medical symptoms that healthcare providers are trained to address professionally and compassionately. I encourage families facing these challenges to maintain open communication with their healthcare team, including specialists like myself who understand the complex interplay between aging, neurological changes, and sexual health. Early intervention and consistent strategies not only improve outcomes for patients but also significantly reduce caregiver stress and improve quality of life for the entire family. Throughout my 12 years of practice, I've witnessed countless families successfully navigate these difficult waters with proper support and education. Your loved one's dignity can be preserved while ensuring safety and comfort for everyone involved. Don't hesitate to reach out to qualified healthcare providers who can provide the specialized guidance you need. You don't have to face these challenges alone. With understanding, appropriate strategies, and professional support, families can maintain loving, respectful relationships while effectively managing the medical realities of dementia. Your commitment to learning about and addressing these issues demonstrates the profound love and dedication that makes all the difference in your loved one's care.